Well, that's a great question. I started as a physician and then moved into managing hospitals and doctor practices, and now working with technology and advising companies on the use of them. So I think the role of information technology, both the infrastructure as well as the content that goes across it, has really changed the way healthcare has been provided. I provided care to patients very much still in a pencil and paper environment. And what my colleagues now do on smartphones and I do in my personal life, I wish I had back when I was actually seeing patients. So it's given a lot of information. It's given us the ability to communicate at distances we never had before. And frankly, it's given the ability for people to not have to be in the same place in order to have an interaction. That kind of location dependence has been very powerful.
Thank you.
I think that we're so used to providing information today on the public internet that there's a natural tendency to just assume that it's safe. I believe that probably consumers are going to be more willing to share information than they might be if they understood the risks. But what you're beginning to see now is those entities that want that kind of personal information in order to use it for healthcare purposes are beginning to think about secure channels so that they can make it easy for the patient to find a way to contribute and participate through a secure channel. Ultimately, for this process to work, there doesn't have to be a whole lot of change on the patient end of the thing, of the process, but somehow or another they have to have the ability to quickly get to a secure method of providing their personal information. And I don't think that a couple of bad events is going to sensitize the public, but I think in general that the industry is working toward those lines, and by the time we know what to do with that information, I think the problems of security will have been solved.
Thank you.